dear students. I am Richa Shakya, Assistant Professor from Noida Institute of Engineering Technology, Pharmacy Institute, Greater Noida. And today I am here to go in the presentation on the subject, that is a pathophysiology. The subject code is a BP201T, and this subject comes under the Dr. APJ Abdul Kalam Technical University. And today's topic is the inflammatory bowel disease. This is the topic from the unit number 4, unit number 3. So this is the topic in which we study about what is IBD, what is the classifications of IBD, and what is the treatment and what is the pathophysiology behind the IBD. So now start with the introductory part of the IBD. So now, first of all, we have to understand what is the meaning of inflammation, right? So the first is the inflammation. Inflammation means there is a irritation, there is some causes of swelling, irritation, pain, itching. These are the common symptoms of the inflammations, and whenever this inflammation occurs into the intestine, and this cause the problems related with the digestive system. So this may occurs the bowel disease. So this bowel disease, this inflammatory bowel disease represents the group of intestinal disorders. Means all the bowel disease, means all the IBDs is represented as represented as the intestinal disorders, and this is the prolonged inflammation of the digestive tract. Means this is not a short duration, but it is prolonged. Prolonged means it is from the very long time of period they goes on, right? So what is the basic IBD? IBD is a disease which comes with the group of intestinal disorder that cause the prolonged inflammatory of the digestive tract, and just due to the because of this IBD, there are various functions related with the digestive system, they are dysfunctional, and due to the dysfunction of the digestive system functions, so there is so much problems related with the intestinal, or there is so much problem related with the digestive tract. Now this is the spectrum of chronic idiopathic inflammatory conditions. So this is the chronic disease, right? What is the chronic? Chronic means there is a prolonged, there is a long duration of the disease. So this is a spectrum of idiopathic inflammatory conditions. Now, so this IBD basically classify under the two basic categories. Means this IBD is classified as the two types, that is ulcerative colitis, and second is the Crohn's disease, right? So this ulcerative colitis is a disease that causes the mucosal inflammation causes, and due to mucosal inflammation, they cause a sores in the lining of the large intestine. So basically, if we talk about the ulcerative colitis, so the main points you have to learn about what is ulcerative colitis. These ulcerative colitis are the disease which cause the mucosal inflammation. Means there is a inflammation in the mucosa of the intestine, and which part of the intestine? It is the large intestine, okay? And this is the reason where the major kind of the inflammation occurs in the part of the colon. So this ulcerative colitis is a disease which cause the mucosal inflammation, and this causes the sores. What is the source? Source is the ulceration. And what is ulceration? Due to the excess inflammation, there is some cuts. So there is an intestine. So there is a various kinds of inflammatory organs which causes the damage of the mucosal layer of the mucosal layer of the intestine, that is large intestine, which cause the ulcers, right? So ulcerative colitis is a disease that cause the mucosal inflammation and sores in the lining of the large intestine, especially in the part of the colon. Now next is a Crohn's disease. So Crohn's disease is the chronic, relapsing, remitting inflammatory disease of which gastrointestinal tract affect the site of the mouth to anus, means this Crohn's disease entire the GIT part, right. So, this Crohn's disease cause the relapse. What do you mean relapse? Means it is again and again, this is repeating process. So, this is chronic, means this is for the prolonged period also, and this Crohn's disease occurs in the entire part of the GIT, rather than this ulcerative colitis is also only occurs in the large intestine. So, this is a major difference between the ulcerative colitis and the Crohn's disease. Ulcerative colitis only occurs in the large intestine and it causes the mucosal inflammation in the lining of the large intestine. But this Crohn's disease occurs in the entire part of the GIT, means from the mouth to the anus part. This is a total part of the GIT, and this is the cause entire part of the GIT. So, see, this is the ulcerative colitis and the Crohn's disease. Now, if we talk about in the detail about the ulcerative colitis, so ulcerative colitis is the immune mediated disease that cause the ulcers in the large intestine, and the people have the both condition at the same time, but they are the different causes. Like, means ulcerative colitis is immune mediated, means if the immune response is immune mediated, means there are some cells which cause the mediation, which cause the immune response, but due to this ulcerative colitis, their immune response will go down, will go slow. So, that is why the inflammation occurs into the large intestine part. Okay. So, this ulcerative colitis is an immune mediated disease that causes the ulcers, right. Ulcers means there is a source, and especially in the large intestine, the part of the colon, and the people have the both condition at the same time, but they have a different causes of the ulcerative colitis. Now, if we talk about the symptoms, so symptoms of the different digestive conditions which can similar, that is why it is important to work with the healthcare professionals to ensure that what is the mechanism behind the ulcerative colitis. Means there is a various causes where there is a various etiologies behind the ulcerative colitis. So, whenever the person diagnosed with the ulcerative colitis, so first of all they have to know the proper cause of the ulcerative colitis, that how and what is the reason behind this ulcerative colitis. So, there is a different causes behind this ulcerative colitis. So, whenever the person is going with the diagnosis with the ulcerative colitis, then they have to know what is the mechanism, what is the cause behind this intestinal disorder. Now, symptoms, and these are major symptoms during the ulcerative colitis. So, the first is the blood in stool. So, due to the whenever the person is suffering from the ulcerative colitis, so what happened at that time? At that time the person is suffering from the sores, suffering from the ulcers in the intestine. Whenever the ulcers they are burst out, they cause the bleeding into the intestine. So, whenever the person goes for the fecal removal, the stools pass with the blood. So, the first symptom is the blood in the stool. Second is cramping, abdominal pain, means there is a pain in the abdominal area, there is a cramping of the abdominal pain just because of the inflammation into the large intestine part. Diarrhea, fatigueness, fecal incontinence, means just it is a condition where the fecal is removal in the very unconstant way. Now, fever, mucus in the stools, urgent need to remove the bowels, and using the bathroom at the night, means at that time the person is going to the using the washrooms at the night because very frequently, because just because of inflammation in the large intestine. And last one is a weight loss. So, these are the symptoms behind these are symptoms behind the ulcerative colitis. Now, if we talk about the Crohn's disease, right. So, earlier we talked about the Crohn's disease. Crohn's disease, it is a chronic, and this disease cause entire part of the inflammation in the GIT, right. So this Crohn's disease is the inflammatory, it's a kind of the, it is a classification of the inflammatory disease, and it is a cause of the digestive tract. It is the entire part of the digestive tract which can cause the, which can leads to the abdominal pain, severe diarrhea, fatigueness, weight loss and malnutrition. So these are the some common symptoms just because of the Crohn's disease. So there is a abdominal pain, there is a cramping, abdominal pain, severe diarrhea, fatigueness, weight loss and there is a malnutrition. Okay. Then this inflammation caused by the Crohn's disease can involve a different area of digestive tract in the different people. So this Crohn's disease occurs just like this. This is the small intestine. Just we take the example of the small intestine. So whenever the Crohn's disease occurs, they occurs in the different segments. They occurs in the alteration segments. They are not continue. They are not continue. They are only alteration, means there are the different areas are there. This is an example of the small intestine, but there is the entire part of the digestive system where there are the different parts of the digestive system where this Crohn's disease may occur. Now, if we talk about the Crohn's disease symptoms, so these are the major symptoms. This is a diarrhea, fever, fatigueness, abdominal pain, cramp with the cramping pains, which is cramps, blood in the stool, mucus sores and the mouth sores, because whenever the person is not able to remove the bowel properly, then there is a cause of the mouth sores just because of the dysfunction of the digestive system. Reduce the appetite and the weight loss just because of digestive system is not properly working just because of this Crohn's disease. So person can't get able to take the food, so they are reduce the appetite, and due to this loss of and due to this reducing of the appetite, the person is going with the weight loss. Now, pain or a drainage near the around the anus due to the inflammation, and this turns into the skin fistula. So whenever the person is not able to pass the stools properly, or there is some constipation because digestive system is not working, right. So at that time what happened? At that time the person is suffering from the constipation, right, and due to this kind of constipation, the person is not able to remove the stools very smoothly, and just because of this, a person may use the more force to remove the stools, and this may cause the tunnel into the skins, and this may cause the skin fistula. So this Crohn's disease may cause the fistula. So these are the symptoms of the Crohn's disease. Now, Crohn's disease, there are the different parts. As I told you that this Crohn's disease occurs into the different segments of the digestive system, right. So this Crohn's disease is a different types. It is a 5 types, that is a ileocolitis, ileitis, gastroduodenal Crohn's disease, jejunal ileitis, Crohn's colitis and Crohn's phenotypes. So these are the types of the Crohn's disease which occurs in the different segments of the digestive system. Now, this what do you mean by the ileocolitis? So ileo means there is a part of the ileum, right. There is a system, there is a digestive system, जिसमें कि हम different parts पढ़ते हैं. So there is a inflammation, there is a ileum. So this inflamed the end of the small intestine, that is a part of the ileum, and at that portion of the large intestine, the colon, means this ileocolitis cause the inflammation in the region of the end part of the small intestine which is known as the ileum, and the some part of the large intestine which is known as the colon, right. So, this is the ileocolitis. Now, ileitis, what is ileitis? There is inflames that last section of the small intestine. So, this ileitis is known as the, there is a inflammation into the small intestine only. Ileocolitis means there is inflammation in the ileum as well as colon, but ileitis means there is only inflammation in the ileum part. Okay. Now, gastroduodenal Crohn's. Gastroduodenal Crohn's means inflammation in the stomach, and it starts with the small intestine. Means this gastro means, as a word denotes, gastro means stomach region and duodenal means the duodenum. And so, this gastroduodenal means there is inflammation in the stomach area and there is inflammation in the duodenum area, right. Now, jejulitis. So, this is the inflammation middle part of the small intestine which is known as the jejunum, right. So, this jejulitis means there is a part of the jejunum. Whenever you heard about the itis, there is a word itis, I-T-I-S. So, this means the inflammation, right. So, this jejulitis means there is an inflammation in the middle section, in the middle part of the small intestine, that is known as the jejunum. Now, last one is the Crohn's colitis. So, it is the, as the name denotes, that is the colitis means inflammation in the colon area only. If there is a ileocolitis, there is inflammation in the ileum as well as the colon, but only is a colitis. So, there is inflammation only in the part of the colon, and if it is ileitis means it is a only inflammation into the ileum part. Now, if we talk about the pathophysiology behind this events, this kind of disorder, just like IBD, IBD or ulcerative colitis, or there is a Crohn's disease. So, first is the triggering events. What do you mean by triggering events? Triggering events means there is some events which cause the inflammation. There are some causes which cause the inflammation. So, these are some triggering events which cause the dysregulation in the inflammatory and immune responses in the genetical susceptible persons. Means a person whose immune system is weak or low. So, at that time, whenever some inflammatory mediated substances are occurs in the body, so they first affected the person whose immune system is low, right. So, what they do, they just dysregulate the immune responses of that particular person. Now, after that, whenever there are some immune cells, just like CD4 cells, CD8 cells, but this IBD only occurs for the CD4. Always remember this point that IBD is only caused due to the CD4 cells. CD4 cells are the immune defensive cells. So, whenever the CD4 cells are not able to show the mechanism of immune responses, immune defense mechanism, so the person is going down to their immune system. Now, whenever the person is whenever the CD4 cells are not producing much amount, or they can't perform their proper functions, they amplify the immune responses and they releases the inflammatory mediators. Means whenever the CD4 cells are suppressed, means CD4 cells अब नहीं बन रहे हैं, तो what happened at that time, जितने भी हमारे inflammatory mediators होंगे, they are activated. So, whenever they are activated, they cause more and more inflammation into the intestine, right. So, they amplify the immune responses cells, due to which the release of the inflammatory mediator cells which release the release of TNF alpha pro-inflammatory interleukins. Okay? So whenever there is a release of the inflammatory mediator, these are the release of the TNF alpha, right? These are the inflammatory mediators which cause the inflammations. These cause the TNF alpha pro-inflammatory interleukins, IL-6, IL-4, IL-2, there are the different kinds of the interleukins, though these are released and they cause the inflammation into the intestine. Now, mucus, just because of this release of the this release of the inflammatory mediators, what happened that time? They just break down the mucus. There is a mucosa line into the intestinal part. So they just break the mucosal breakdown and continuous exposure to the lumen, dietary or the bacterial antigens. So there is a mucosal lining which can rupture just because of these inflammatory mediators, and whenever these inflammatory mediators are ruptured, this mucosal membrane is a protective membrane, right? So what happened at that time? They just cause the inflammation of this breakdown of the mucosal layer, and thus because of this impairment handling of the microbial antigens by the immune system, and this cause the inflammation, right? So this is a process of how the inflammation occurs into the small or the large intestine or the GIT part. Now, inflammation is loss of the fine vascular patterns. This increase the mucosal friability, and this cause the ulceration, exudates pseudopolyps, and this cause the ulcerative colitis. Now, what happened at the kind of condition of the Crohn's disease? So inflammatory plus subsequent injury of the tissues, and this cause the crypt influx of the epithelial necrosis, means the epithelial layers will broke down, and due to this focal aphthoid ulceration will occur, and this inflammatory mediators occurs the various kinds of the inflammation, and finally there is a bowel wall thickening, and due to which the cause of the Crohn's disease. Now, the exact cause of the inflammatory bowel disease remain unknown, but there are some conditions when the diagnostic will diagnose the condition of the IBD. Now, one of the possible cause response may be the malfunction of the digestive system when the immune system is not working properly. So the bacteria, the viruses can attack on the immune system, the digestive system. Due to this, the digestive tract will not perform properly. So this is one of the response by which the this IBD may occur. Heredity is also seems the important role in the cause of the IBD. Now, risk factors. So these are the risk factors about the age, race, family history, cigarette or smoking, use of the NSAIDs as a non-steroidal anti-inflammatory mediators. These are the drugs which are used frequently. The person is whenever use the NSAIDs, so they may cause the ulcers. Now, complications, if we talk about the complications of the ulcerative colitis or the IBDs, so the ulcerative colitis and the Crohn's disease have some complications in other than specific of each conditions. So they may cause the colon cancer. So whenever the person is continuously suffering from the ulcerative colitis or the Crohn's disease, they may cause the colon cancer. Now, skin and eye joint inflammation. So there is a certain disorder including the arthritis, skin lesions, inflammatory eyes may cause the IBD flare-ups. Now, medications may also medication is also cause the side effects and which cause the ulcerative colitis. As I told you, that the excess use of NSAID drugs. The excess use of NSAID drugs may cause the ulcerative colitis. There is a corticosteroids which can use for the treatment of the osteoporosis, but this may cause the these kind of disease. Now, primary sclerosis, these are condition of inflammation scarring with the bile ducts and eventually which narrow the causing liver damage. Blood clots, so IBD increase the risk of the blood clots in the veins and the arteries. Bowel obstructions due to the because of hardening of the bowel lining. There is a thickening of the bowel, there is a thickening of the intestinal wall. Due to this, there is a bowel obstructions, and due to this may cause the blockage of the blockage of the excretion of the digestive content, which cause the fistulas. Right. Malnutrition, so malnutrition means just because of the diarrhea, abdominal pain, cramping, the person is not able to take the sufficient amount of food. So, this may cause a malnutrition, and this cause the low iron or vitamin B12, which cause the severe kind of diseases. Fistulas, as I told you, just because of the hardening or the thickening of the bowel wall or the intestinal wall, they cause the fistula. Anal fissures, there is some small tears in the tissues which lines the anus in the skin and where the inflammation can occur, and it often the painful movement leads to the perianal fistula. Now, there is a complication which includes the includes the ulcerative colitis, just like toxic megacolon. This toxic megacolon will occurs the swelling of the colon, and there is ulcers in the ulcers in the colon. There is a dehydration just because of the diarrhea. So, these are some complications related with the ulcerative colitis. So, these are some lab tests for the diagnosis for the ulcerative colitis. These are the tests for the anemia or the infections. There is a study of the stools. So, whenever the person is suffering from the stools with the blood, so person is checking with the some kind of lab test. Now, colonoscopy, so just to detect the inflammation of the part of the colonoscopy. So, there is a use of the camera, and which insert into the this anal part, and this is used for the colonoscopy. Now, flexible sigmoid, so these are used for the same as the colonoscopy. These are performed. Now, these are the some other procedures for the endoscopic, for the lab test for the detection of the ulcerative colitis and the IBDs. Now, there is a treatment. So, there is a more drugs which are available for the treatment of these IBDs. There is inflammatory drugs, that is a mesalamine, beliside or oxalacide. Immune responsive or immune system suppressors, these are azithromycins, mercaptopurines and the methotrexate. Antibiotics, these are ciprofloxacin and the metronidazoles, these are the antibiotics, and other medications and supplements just like antidiarrheal medications, and pain reliefs just like acetaminophen, ibuprofen, naproxen, sodium and diclofenac sodiums. These are the vitamin supplements, these are the used for the treatment. Now, nutrition supplements, so there are some nutrients which are giving to the person for the nutrition support. Then last one is the surgery. If a person is not able to overcome or heal up with these kind of disease, the person is going with the surgery. Then there is a removal of there is a surgery of the ulcerative colitis, there is a surgery of the any part of the digestive system where the Crohn's disease or where the ulceration occurs. So, these are the treatments regarding with the IBD. So, this is entire about the treatment, what is IBD, what is the classification of IBD, what is the symptoms of ulcerative and the Crohn's disease, and what is the treatment of the IBD or the Crohn's disease. So, thank you.